Hey everyone, Chris again. Well, this is probably new to you, but I'm recording this on Sunday, September 21st. It is 10:40 p.m. my time, 8:40 p.m. your time. And this is my second recording of the day, so bear with me if I'm a little, but we'll see how it goes. So, let me go ahead and share my screen. And I am going to get into slideshow. Cool. All right. Welcome to week 7. So for today's check-in, I want to do some square breathing or box breathing. So we're gonna do this a couple of times and just kind of find your chair, find your seat, find the ground, find gravity, however that lands for you and feels comfortable for you. Sometimes I like to put my hand on my heart, um, and also over my diaphragm. You can't really see my diaphragm here, um, just to kind of make sure that I'm breathing into my belly and not just my chest. Um, this is a really good exercise for folks who struggle with anxiety, or if you're feeling overwhelmed and you can kind of feel your thoughts just kind of going like, blah, 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 blah. This is something you can do in public, you don't have to think too hard, but essentially we're gonna breathe in for 4 counts, hold for 4 counts, breathe out for 4 counts, and then hold for 4 counts. um, it's pretty simple, but I would also challenge you to, when you're holding your breath, there's kind of this instinct to just kind of like close off your airway. But if you have the ability of holding it while not like actually closing off your airway, it's kind of interesting and a little bit more of a challenge. And also kind of prevents you from actually like clenching. Um, so let's give that a try. And you can close your eyes if you want, you can stretch it out if you want. Um, but yeah. So, okay. We're gonna breathe in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4. Breathe in, 2, 3, 4, hold, 2, 3, 4. Breathe out, 2, 3, 4. Hold without clenching, 2, 3, 4. In, 2, 3, 4. Hold, 2, 3, 4. Out, 2, 3, 4. Hold, 2, 3, 4. There you go. These are some tangible things we can share with our clients. And also, like, if you're feeling that like craziness in the moment, like, especially if you're working with kiddos and it's like, you can practice these kind of mindfulness things or these touching in with our bodies things, to help you get grounded in the moment as well. And that can be super helpful. Some general reminders. Tomorrow is the first optional synchronous Zoom meeting for us all to say hi, howdy, hello. But by the time most of you are seeing this, that will have already been done. So there are 2 left. Make sure you check that. Again, your individual meeting with me is due by Monday, October 20th. Sign up for a time on Calendly. Email me if the times on Calendly don't work for you because I'm flexible and I'll make it work. You just let me know when you're free, okay? Um, Weekly assignments. Don't forget to keep up on your activities and assignments. If you've missed any of the check boxes, like if you didn't do the solo reflection, or if you didn't get a chance to practice with your peer that week, you can always do it not within the week and then go ahead and go back and retake the quiz and submit it. And then you'll get full points for it. Okay. I'm I'm kind of going through a wonky time, so I imagine y'all are too. And so I'm trying to give you a little grace, since y'all are giving me a little grace. So please go back and update your quizzes once you are able to complete those things, or if you notice that you missed a checkbox. Um, Assigned partners and peer groups, let me know how those are looking for you. If you have any questions or concerns, reach out to me via email or text. I'll do my best to kind of step in and help figure out what's going on, if there's any wonkiness happening. Cool. All right. Let's talk about week 7. So Week 7, we're going to be talking about motivational interviewing skills for engagement. Now, Dr. Perry, again, the lead faculty for this course, comes from a substance misuse background. And so motivational interviewing kind of started in that vein, but has kind of expanded out because a lot of the skills are pretty applicable. I'll say that I've used a lot of these in the different kind of environments that I've worked in, because we all have stuff like, we're not coming to therapy because everything's good, right? We're coming to therapy because something's up and we need help. And really, you can be the most resourceful person in the world, but you can get to a point where you have done everything you can possibly do yourself, and you just need like a non-judgmental person who's outside of the situation, who can just reflect back to you what's going on, or some other ideas, because if we all just live in our own heads all the time, it's gonna it's gonna limit us in our ability to move forward, right? What we're going over today are the stages of change, which I know I linked a resource in last week's lecture, but this we're going to go into it a little further. I didn't look far enough ahead, so apologies if y'all dove into that, but we'll go quickly through that. The spirit of motivational interviewing and the methods of motivational interviewing. I know for some of you, this is going to be a review. um, some information about exchanging information and just like changing your perspective on how to exchange information with your clients. Um, Evoking hope and confidence. So having this be not a you problem, but a we work together kind of um, partnership and collaboration, ways of turning things into something that is positive. Um, how to answer the question, what do you think I should do? And some special topics that I want to touch on. All right, we got a lot ahead of us. I'll try to go through things fairly quickly. But I do want to, give you some examples, because it sounds like some of y'all are wanting a little bit more of like real world examples, so I can draw from my experience for that. Okay. Here are the stages of change. So we've got pre-contemplation, which you might not even be aware that there's a behavior that is, preventing you from doing something you want to do. Um, uh, but there's just no intention of changing the behavior. Contemplation, so that moves into contemplation, where you're aware that a problem exists, but there's no real kind of commitment to action or motivation to change it just yet, but it's just kind of like maybe a rock in your shoe that you're starting to get aware of, and now it's starting to like be a little iffy, right? Preparation is intention. So like, the intent to take action. So like maybe, calling a therapist for the first time and scheduling an appointment, or that kind of thing of just like, you know what, I think it's time. Like I think I need to start taking some steps and mapping out how I want to change my behavior. Or I've been so depressed for so long. Like I don't remember the last time I really felt like I enjoyed doing something, that's not normal, or like that's not how I want to live my life, and then really getting into that place of like, you know what, I need to do something about this. And then we go straight into action, which is active modification of the behavior. So, if you're in therapy, like we're throwing interventions at you, we're throwing homework assignments. We're like, come on, what can we do? Let's try this, let's try that. What worked in the past, right? Um, and so this is like actually taking those steps to attempt to change the behavior. Then we go into maintenance, right? So if we've effectively kind of modified the behavior, um, we want to maintain and sustain that change so that the new behavior replaces the old behavior so that we don't just kind of go backwards, right? There's like this old saying that it takes like 28 days to change a habit or something like that. I think that's been disproven because also you know um like trying to uh change your sleeping habits is different than getting out of an abusive relationship. Like there are so many things internal and external that affect this process as well, right? um and then there's the potential for relapse, where we fall back into patterns of behavior, like old patterns of behavior, um and we kind of go back into the cycle again, right? So like this is why, for example, like dieting, right? They say dieting doesn't work. Let's not do dieting. It's a lifestyle change, right? So if you want to like lose weight and keep it off, like you don't want to do the yo-yo dieting thing. It's literally it's a lifestyle change, right? That's the goal, at least. And so, we kind of go into this cycle again and again. And relapse, you'll notice, is not it's not a bad thing. It's built into the cycle. So even if we are talking about substance misuse, even if we're talking about somebody who has like a gambling addiction or just is in a pattern of behavior like with anger or something where things can get hairy, right? Relapse is built into this. We don't expect people to change their behavior and like have it magically just fit and permanently change, right? It's built in. um and you'll see too in the middle of this circle here, we've also got a spiral, right? Something, so in motivational interviewing, the spiral is upwards, right? Like we learn from our our constant kind of going back and forth of this. But like something I've noticed like in hospice and what I've been telling people in therapy, there are folks who have worked on stuff before and then they come back in and they're like, somebody loses a family member and they come in and they're like, oh my God, I just lost this person, but now it's bringing up all this old stuff that I thought I had worked past. What I like to say is it's not like a spiral that necessarily goes up. It's that we come back to the same lesson again and again at a deeper and deeper level of understanding and place, to be able to kind of get deeper into it, right? So it's not a bad thing that we come back to these lessons. It's that we're encountering them at a deeper and deeper level of our understanding of them. So hopefully that's helpful. Uh, Another thing too is if we do end up breaking the cycle, relapse becomes transcendence. Um, Again, there's no judgment in this either. I think that's what I was trying to say earlier. Falling back into old patterns of behavior, especially in times of stress, especially like right now in the world with so much fear, a lot of people are returning to behaviors and patterns that like, we isolate, we get afraid, right? And so it's very easy to fall back into old patterns and old behaviors that helped us before, right? It's easy to change behavior when everything's going well. It's really hard when stuff is not aligned right and you don't have the capacity to really implement the change in the way you would want to. Um, so the spirit of MI is pace, partnership. So our power in motivational interviewing and in the therapeutic relationship is collaboration. Um, your clients, I always like to say this, like you're the captain of the ship. You get to steer it. I'm just here. Like I'm not just here, but like I'm on the ship with you and I can, point out what I see, but like at the end of the day, the client is the captain of the ship. I'm not there to tell them to do anything. In particular, I'm not there to judge them. Like, we're on their seas when they come into my office, Um, so yeah, they get to steer the ship. Um, Acceptance. So absolute worth. This is very similar when I was in my MFA program. It was partially like a Buddhist program. And so there's this idea in Buddhism about basic goodness. Like we all have basic goodness, which if you don't necessarily ascribe to that, or if that feels icky right now, especially because of the world the way it is, um, everybody's life has inherent worth just because we're alive, right? Um, and so just like whoever's in front of me, no matter what they're dealing with, no matter what they're coming to me with, their concerns, their past experiences, what they've done, like they have basic worth, and that I'm not going to compromise at all. Like that I'm not, it's that whole it's that feeling of like the non-judgment piece, right? Um, Accurate empathy. So there's like always something you can find out about a person that is going to kind of make you want to dive a little deeper, right? Um, you can find an entry point, like even the folks who are the most closed off, there's always an entry point to, just who they are and what they're passionate about. And so if you approach them with genuine curiosity, it allows space for that accurate empathy to come in. Um, Autonomy support. So this is self-determination of the client, right? So they have this was something, oh my gosh, when I was in hospice all the time I would have to bring this up because we would have folks on hospice who were smokers. And I mean, it's one thing if there's oxygen in the room, right? We don't want anyone to blow anything up, right? Like that is definitely not the point. But people have the right to make bad choices, right? Or what we might consider bad choices. Or if you're working with an interdisciplinary team like doctors and nurses, they might come in and try to be telling this person who is, in their last days of life that they should quit smoking. And it's like, is that really going to help them right now? I don't think so. I really don't think so, you know? So if it's not a safety issue, like maybe let's not. Um, and I also honestly I don't consider personally cigarettes to be like, when we talk about addictive behaviors, right? I don't consider cigarettes within that because, just my interaction with the healthcare system. There's so much judgment over folks that smoke that I just to me, it's like folks know that there's no shortage of information. I don't think there's anybody out there who's like, smoking cigarettes can actually help your health. Like, no, like people can make choices, right? Like, that's fine. Um, and then affirmation is under the acceptance piece as well. So like I try to tell people that I'm there to be their biggest cheerleader, right? Like whatever their goals are, that's what I want for them. I'm not there to tell them what they should do or what they should want or, you know, anything really. I'm just there to be their biggest cheerleader and not in a way that, like, if that's not your approach, that's fine. You don't have to use that verbiage, but like, whatever your way of genuinely caring about the person in front of you and wanting what they want for themselves, right? Like wanting that for them. That's kind of your entry point. Compassion. We have to have compassion for our clients. Like just basic compassion. I think that kind of ties back into this basic goodness feeling or the absolute worth. Um, and then evocation. So what motivates the client? Like what are their values? Like what are their core values? What strengths do they have? Part of the biopsychosocial spiritual cultural assessment is is touching on their strengths, right? And it's funny because half the time I'm talking with new clients, they'll be like, Oh gosh, I don't even know. Like, but I've heard them say five things. Like clearly you work so hard to make sure your family has what they need, or you're an excellent provider for or caregiver to, a relative who needs your help, or you are a good storyteller, or just I mean, people don't even realize their own strengths, and it's not something that is highlighted and centralized in our society. And so the more you have the ability of like starting that dialogue and reinforcing it in the room, the more that's going to sink in and start to change the internal narrative and dialogue that people are having with themselves. Because like this whole rugged individualism thing is very much like, it puts us in this, the fighting stance. It doesn't put us in like the perspective of like we all have strengths and we all have like ways that we can show up for each other and for ourselves. Um, and also people, I mean, as an elder millennial, right? Like we know how to Google resources, right? Some of us are better at it than others, but usually folks have a support system in place, or a good friend, or a pet, you know? What are the resources they're already utilizing? Even like just the fact that you're in the room with me, that's huge. If that's the only thing they've done, that is huge, right? That is a huge strength and a resource right there. They're in the room with you, and that is something, because not a lot of people are able to do that. And what's going well? What's already going well? That question. What are you enjoying right now? What gets you out of bed in the morning? So the methods of MI. We've got core skills, which are our oars, right? Um, I guess boating, sorry, oars. Um, so open-ended questions. These are huge. So it's some of the biopsychosocial, you're gonna have to ask direct questions, like date of birth. Like it's not, you can't ask that, or like where were you born, like that kind of thing. Like some of them are going to be direct questions. Not all of them can be open-ended questions, but like for example, like what brings you into therapy, or what what do you want to work on? What's going well? What is most difficult right now and why? Can you tell me a little more about that? Those kinds of things. Affirmations. So again, just that piece of like what we see, which to me ties into reflections, but like when somebody says something positive about what the work that they're doing, you can reinforce that by affirming it, right? Just being like, people, especially who are just starting this work, they'll be like, well, I mean, I guess I did this thing, okay. And you're like, yeah, you did. Yeah, you did. And honestly, like I have a client right now who has just gone through some terrible stuff. And they were just like, it sucks. It really sucks. And I was like, yeah, it sucks. Understatement. Understatement, it sucks. Right? So that just again affirming that their experience is like real and valid. Um, reflections. So reflections like very much just kind of um what I'm seeing or what I'm hearing is this, right? Like so when somebody is like oh gosh, I'm trying to think of a good example. Like sometimes people will come in and just like they'll rattle off the whole story, and it's just like, well, so you've told me all this stuff, but what I'm seeing in front of me is that it looks like you've got a lot of sadness around that. So can you tell me a little more about like what's going on with this grief or this anger, or um, you know, uh that might not be the best example, but like reflecting it back also kind of feels like summarizing to me too, which again, these all feel like core skills of just being, a social worker in general. We just got to be curious, right? And then like at the end of the big rattling story, or at the end of the session, you summarize. So we talked about uh sadness today. We talked about, you know, your relationship with your family. We talked about what it means to you to be at end of life or your family and you know how work is going and all this stuff, right? Um Summarizing is kind of also a way of displaying that you've been actively listening. Um so it helps the client understand that you're with them. Um without making it feel like, you know, inauthentic, right? Um, I feel like we're getting towards the end of the day here for me. It's like 11 o'clock now. So bear with me here. For processes, engaging, obviously, from the first time you reach out to your clients, whether or not it's to schedule an intake or to introduce yourself or to, you know, follow up on a referral, what have you, engaging the client is like the first piece, right? Once you've got like a rapport going, focusing. So that's basically like, okay, what are the biggest symptoms you're experiencing and how are they impacting your life? And what are we wanting to use this time together for? Like, how are you wanting to change what's happening? Um, Evoking, right? So this is like the actual, this is the work of like the homework, the questions about like challenging clients' stances or like their beliefs, you know, that like are getting in the way of their stated goals, right? And we also plan. So planning, you're going to hear a lot about SMART goals, let me tell you, especially if you have to do treatment plans. Um, they have to be specific, measurable, attainable. I can't remember what the R is or the T right now, but you know, you want to be able to have a specific thing you're working towards and ways that you are working towards it. So, um, like for example, this the scales. So if you're doing the scales, I would do a scale at the beginning when we first started working together to measure where we're at right now. Um, and to help justify the treatment, right? And then maybe halfway through our treatment, like, okay, we're doing 16 sessions together at week 8. Let's do this again and see if the interventions we've been doing or trying are working. So we should see improvement, right? And then whether or not that is reflecting will help inform whether or not we need to adjust the treatment plan. And then at the end, right? Before termination, you want to make sure that that you know goals have been achieved and that the client feels like they've got things under wraps or a hold of things for this go round, right? Because we know relapse might happen and they might need therapy again at some point. Um, so in exchanging information, especially going into school, especially getting specialized training, right? We're often taught that like I'm the expert on why and how clients should change. But really, kind of the perspective, and I know I said this before, is like, you know, I've got some skills, but really, like, the person in front of me is the client and they're the expert on themselves. So I can provide skills all day long, but they're the ones who get to tell me if it's working or not, or if we need to try something else. Um, you know, I collect information about problems. It's like, well, no, I figure out, you know, what the clients' wants and needs are and what their goals are. And then we figure out together how to achieve those goals. I rectify gaps in knowledge. Uh, how about I match information to clients' needs and strengths? So this is like if we're talking about like psychoeducation. A lot of people, you know, like when you have anxiety for the first time, uh, it feels like you're having a heart attack, you know, or like a panic. If you're having a panic attack, it can feel like a heart attack because there is very like real tangible evidence of the effect of, you know, psychological symptoms on the body. You know, the body keeps the score, right? Um, and so sometimes, especially if we're kind of cut off, like if we're just in thinking mode and we're cut off from our bodies end up having to interject and be like, whoa, 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 no, things are not okay right now. You might be powering through, but we're not cool. Like we need help. So, folks need help with psychoeducation about like, because we're not taught this information, you know, we don't have the emotional literacy. So many of us were not taught that growing up. And so, you know, it can be scary. So frightening information is helpful. No. Clients can tell me what kind of information is helpful. Again, I'm not here to tell people what's good or bad or whatever. They can tell me what their goal is, and then I can help support them in providing information that supports them in that goal. And they can also tell me, I ask for feedback all the time. Like the way I do in this class, that's how I'm in every therapy session. I'm like, okay, I want you to try this. You let me know how it works. Okay. Like, and I also say too, if I say something or do something that is like wonky, please let me know. Um, you know, not like I'm planning on that, but I want it to be a safe space for whoever walks in the door. I need to just tell them clearly what to do. Uh, Advice that champions client needs and autonomy is helpful. So instead of just saying, well, clearly you just need to stop that. I mean, that's that thing of like, well, just stop being anxious or just stop being depressed, right? It's like, oh, thanks. Yeah, I was just, it's all gone now. No. Um, Again, meeting the client where they're at, letting them take the lead. We can't force people to do work, right? We can't force people to do things before they're ready, and we shouldn't. Like, we really shouldn't. So, putting matching the client where they're at as far as the effort that they're putting forth. Social workers, we have a tendency to dive right in and just like be like, okay, here are all these resources, and here's this, and here's that, and here's this. But then at the end of the day, if the client isn't taking that and running with it or meeting you where the resources are, then it's not going to be useful for either of you. Um, so yeah, meet their pace with what their needs are, right? Um, and what they're asking for in therapy, right? As far as resources and information. So evoking hope and confidence. So obviously we want to identify the problem, right? But the problem is never going to be the individual themselves, you know? Like it, we want to support self-efficacy, so asking questions in a way that helps direct folks to what we're hearing them say anyway, you know? Um, and also just like allowing them to do the work, right? So we can, pass out homework sheets or give articles and things like, but you don't want to do that work for them. You know what I'm saying? Like, um, I have a tendency to like create a whole bunch of lists and I'm like, here's all this information and here's that and here's this and here's all these like cool support groups and things. And it's like, okay, I can take a step back. How about you take a look and see if there are any groups that you would be interested in joining? Or, you know, I hear that you're wanting to uh, get out more. There are lots of like volunteer opportunities around and a lot of different communities and, um, you know, various organizations that would be happy to have people. So it doesn't cost money, but you can still get to know folks around you and get to know people in your neighborhood and feel empowered, right? So, how about your homework this week is to find 3 volunteer opportunities that you want to maybe take a look at and potentially go into. From the reading, use the confidence ruler. Or you can also ask folks to create their own measurement scale too, especially kids. Um, Kids in particular, like you can do the pain scale, you can do the confidence ruler, like, whatever. But if that's not what makes sense to them, like they can make their own scale too. Um, you can give information and advice, but like we'll talk about that next slide. Again, identify and affirm their strengths. A lot of this is kind of a little redundant, but it's important. Review their past successes. Like, so when somebody comes in and they're like, my anxiety is like 10 out of 10 every day, it's like, okay, has this ever happened in the past? Well, yeah. Okay, well, what helped you back then? What's different now? So take a look at what worked and why. And even if it doesn't exactly translate to now, maybe it gives you something to start with. Brainstorm. Again, the best thing about working in therapy is when you collaborate, right? It's a partnership. It's like we're both here to do this thing for you. And so you tell me, how can I help you collaborate and make this thing happen, right? Reframing things, right? So, oh gosh, reframing is like just all of the things. Um, I don't know if y'all need examples, but I can definitely think of some in a bit and, give you some if you want. But I think it's kind of one of my go-tos is being able to reframe things in a positive light, but not even positive. It's just like I think so many of us have been trained from a young age to think negatively about ourselves and how we exist in the world. Um, and so it just becomes like inherent that our dialogue internally is like, oh, I suck. Everything's terrible. Then it's like, there's a way to reframe stuff to put a positive spin on it or even a neutral spin. Like it doesn't even have to have like um a value attached to it, right? Think hypothetically. So, I don't know if you've all heard about the wish, like the magic wish question, but like, or the magic wand question. I can't remember right this second, but um, so I've used this a lot, but it's like if you had a magic wand and everything was exactly the way you wanted it to be, um, what would that look like? You know? Or I'll do this like when I'm trying to put together a treatment plan, like so thinking in the future, right? End of therapy, we're waving goodbye to each other, shaking hands, what have you, whatever your way of saying it is. What will successful therapy be have looked like to you? Like what would the end of this time together look like to you? What does that success look like? What will we have fixed? What will we have resolved? What will we have talked about? Respond to confidence talk. So, explore themes, experiences, ideas, and perceptions. Like, just very much try to, again, kind of reinforce. um, and yeah, radical change. Um, again, there's this kind of Buddhist idea, right? That like anybody has the opportunity to become the Buddha at any point in their lives, right? Like we all have that potential in us. And so if we're looking at basic goodness or like kind of that neutral, like non-judgment, everybody's got, you know, basic worth. Um, Radical change is possible, for any of us at any point in time. And that's really inspiring and that gives me a lot of hope. Because today might be the day that somebody makes a different choice. And if not today, tomorrow or next week or next year. Um, and so to keep showing up and giving that space of non-judgment and basic worth that I think so many people are not feeling right now, that can be very, very valuable and very life-changing for people. What do you think I should do? I think we're on 2 slides here. I know this is a bit of a long one, so bear with me. What do you think I should do? So somebody comes in and they're like, oh my God, I've got this thing. What do you think I should do? So why do you think a client might ask this? Um, I think some people do want to just be told what to do, but a lot of times I think we all just get to a point where, again, we're not able to kind of see through our own thoughts in our heads, right? So, well, what ideas do you have? What's worked for you in the past, right? Um, would it be okay if I told you some things that have worked for other people in the past? Uh, what would you like to know about XYZ? I could tell you about XYZ if you're interested. I wonder what you think about this. Take it or leave it, right? Um, if people are asking you something directly and you feel uncomfortable about giving them advice or don't feel you should, you can say that. Like, well, I have some thoughts, but I'm wondering what you've considered about it so far. You know, what are your thoughts? Or what are the big things here that we're juggling or that we're balancing or trying to decide between? Talk me through some of it, you know? So with offering advice, um, that's kind of why the questions on the other side, right? Like the previous slide. We want to engage people first, right? Advice specifically, like we're not life coaches. Um, so we want to use advice sparingly, specifically. You can always ask permission. Is it okay if I give you some information that I think might be helpful? Um, is it okay if I give you some homework that I think might be uncomfortable, but that might be helpful? Um, and obviously emphasize personal choice, like throughout. You can say no, but I want to challenge you to maybe try this thing that I know is going to be uncomfortable for you, but I think might be worth your while to think about, you know? Self-disclosure. Um, why would it be relevant to self-disclose, right? So, um, there are certain things like, it's the therapeutic relationship can be weird. It can really be weird. You're disclosing so much information about yourself and you know nothing about the person in front of you except what you see. There are certain things that like naturally you're going to talk about, right? Like if you have a pet, right? Like, oh, do you have a dog? Yes or no? Like, why would you lie about that? Like, it's just, making conversation is different than self-disclosure, right? Like, um, if you've also experienced a prior trauma that the client in front of you is uh disclosing about, that's probably not a good idea to self-disclose, right? Um, I would say there would maybe be a few rare instances where, in order for somebody to feel safe enough to talk about something, they would feel the need to know about the person in front of them, their therapist, like whether or not they would be able to feel safe enough to disclose. But like people ask me if I have kids, I'm like, oh, why do you ask? You know, I don't need to have kids to be able to work with kiddos, and to have that skill set. And, you know, um, you want to ask too, like, is this disclosure potentially harmful? Um, if you're talking about marriage or something, or you're doing couples counseling, if people are asking you about your relationship, that's probably not going to be a good, vein to go down. Or if you're doing family therapy and they're asking you about your family, and it's not just like the stuff that aligns directly with the work that you're doing in that session. Um, but like be aware that you can't predict how self-disclosure will work or won't in the space, and with the individual in front of you. And you also can't take it back once it's shared. So, you don't have to completely shut it down or shut it off like when it comes up. Like this is something that you're going to have to navigate, um kind of no matter what you do, right? Even in the meso or macro sphere, like you need to know whether or not to disclose. Like so for myself as like a non-binary human, um I had to make choices about whether or not I was going to bring up my pronouns at work. And I've had places where I've felt uh, empowered and encouraged to do so. And I've had spaces where I consciously made the decision not to share because it was not a very like open environment, you know? That was my choice. I'm not saying everybody even has that choice, really, you know? Um, but yeah, and one of my workplaces even changed while I was there because of questions of whether or not you know, like licenses and stuff, all of that, which, again, here we go, self-disclosure, right? Um, but people don't realize the things that we all go through, right? So just it's just something to be aware of. And you're going to make mistakes. I'm going to make mistakes. I have made mistakes. Learn from them, you know? Um, if really like the thing that I like to ask about self-disclosure is in the moment, is it for the person in front of me or is it for me to feel comfortable? You know? Like there are times when I want to open up to others and just say I've been through what you've been through, but really that's not for the client, that's for me. And so I know not to say those things in those times. I hope that's helpful. I also have a link to a YouTube channel called Private Practice Skills that I've found super duper helpful when you're just like talking about like if you're doing an intake for the first time and self-disclosure, those kinds of things. We can talk more about it, but yeah, we're at the end, my friends. Week 7. Thank you for sticking with me through this amount of time here. I hope this was helpful and gave you some more details and specific examples. Y'all know how to get a hold of me if you need me. Email me or text. Make sure that you sign up for a one-on-one before October 20th so you get your time with me. I just want to get to know y'all a bit. Promise I don't bite. Uh, and yeah, have a good rest of your week. Um, yeah.